You know, recently we've been talking about COVID long haulers. These are people who continue to suffer from coronavirus-like effects long after testing negative for the virus. Now, clinics are popping up around the country to serve these patients, including the first of its kind here in Texas. It's through UTHealth along with UT Physicians, and we spoke with both the patient and doctor about the unique services it provides. Rudy Cabrera, a registered nurse who works directly with COVID-19 patients, knew it was only a matter of time.
Woke up the next morning with a high fever, 103, short of breath, coughing, and very fatigued.
Cabrera was in the hospital for 7 days, receiving medications and oxygen. Still, it took several weeks for the virus to clear the 52-year-old's body.
So I had 6 tests done, and all 6 were positive, and I would have them every week.
And like other so-called COVID long haulers, the effects still linger for Cabrera months later.
Patients didn't understand why they weren't feeling better because patients are attributing this to the flu, and the flu, after a few weeks, you're back to baseline. So people were worried about their health. People were worried about when they could actually return to work and maintain a near normal function.
Dr. Bella Patel says the new UTHealth COVID-19 Center of Excellence provides support and treatments for post-COVID patients who still suffer from things like cognitive fog.
They just can't think clearly, memories off a little bit. They're just having trouble concentrating.
Cardiac issues and respiratory problems, like in Cabrera's case.
Before COVID, I'd work over 60, 70 hours a week easily. I'd run about 10 miles every about 3 days a week, no problem.
Dr. Patel says in many cases, patients feel healthy before regressing. The key is for them to pay attention to their body. For more on our series with UT Physicians, head to khou.com/healthmatters.